Right now, the Florida Department of Health reports more than 1.4 million people have been vaccinated for COVID-19. Of those, only 73,089 were Black. Georgia has vaccinated 791,254. 88.8% of the people who completed their vaccination series are white, compared to only 4% who were Black.
And for some, the choice to not get vaccinated centers around mistrust, dating back to the 1930s Tuskegee Project.
ABC 27's Chantel Navarro talked to faith leaders who say it is time for us to move forward before we lose more lives to COVID-19.
Many minorities people have been used as guinea pigs.
Bethel Missionary Baptist Church pastor R.B. Holmes is talking about the infamous 1932 Tuskegee Project. The study of syphilis in Alabama involved 600 Black men, 200 who did not have the disease. They were told they were being treated for bad blood.
I felt that there was an opportunity for them to get treatment and learn more about the disease, but they were treated poorly.
While they were given things like free medical exams, meals, and burial insurance, what they did not get is the care they needed.
Many people died, and the experiment went on for decades, from the 30s to the 70s, and there was a settlement to the family members and the participants, but the damage was done.
Dr. Nasheed Manyoun is the director of the Southeastern Regional Black Archives and Research Center at Florida A&M University. He says that experiment still haunts many in the African American community today. In a study by the National Association of Broadcasters and the Reynolds Journalism Institute, 1 out of every 4 African Americans surveyed said they were hesitant to get the coronavirus vaccine due to safety concerns. When asked to respond to statements like, "I do not trust the motives of whoever's funding the vaccine," 23% of those surveyed strongly agreed.
I roll up my sleeves before the camera to lead by example.
Pastor Holmes is the chair of the Florida Coronavirus Vaccination, Community Education, and Engagement Task Force, with the goal to get at least 60% of African Americans in the state vaccinated. Part of the group's objectives include developing targeted messaging for different communities and outreach in underserved areas like the 32304 and 32305 zip codes. Also leading by example, Bond Community Health doctors like Kelly Miller, who says it's time to move forward.
I have had it and I have done fine. I'm actually waiting on my second dose as we speak. So I would just say go ahead and get it.
Dr. Miller is part of the group distributing vaccines to underserved communities on Tallahassee's South Side. While she understands the hesitation to getting the vaccine, she knows the same risks do not exist today as they did during the Tuskegee Project.
Since the Tuskegee experiment, there are a lot of checks and balances in place that prevent the likelihood of that happening again. And this vaccines, actually both of the vaccines were tested in a lot of people, and they have been proven to be at least 95% effective.
While the impacts of the syphilis study were devastating for African Americans, the impact of the coronavirus is already far greater. Health and community leaders say it will only get worse if people choose not to get vaccinated.
It's time for Americans and African Americans to begin to trust science. We've had a lot of death as a result of conspiracy theories and quote-unquote claims of fake news. We must be engaged. We must educate our people. We must inform our people and inspire our people that these vaccines can save lives. And we're in the business of saving lives.
Conspiracy theories are also to blame when it comes to that mistrust. We've seen it most recently with the death of baseball legend Hank Aaron. Aaron took the COVID-19 vaccine as part of a movement to encourage other African Americans to get vaccinated. When he died only days later, rumors on social media claimed his death was connected to the vaccine. Aaron's autopsy revealed that he died of natural causes, that there was no evidence that his death was linked to the vaccine.